My name is Pebbles King, Public Health Bureau Director with the Mobile County Health Department. And at the Mobile County Health Department, my bureau in particular promotes healthy development. We provide services surrounding lead prevention education, tobacco education, overdose prevention. We are a county custodian for vital events for anyone born, live, reside, in Alabama. We also provide services to our faith-based and community-based members as it relates to health disparities, health equity. Our community health worker programs is able to impact our community, specifically ensuring that our citizens are able to live a productive life. Well, I wanted to, impact the community outside of just the clinical services or medical services that you think of when you think of public health. And by doing that, I became a part of the Mobile County Health Department in 2006 as a health educator. So, we were starting in elementary, middle, high school, as well as going to senior centers, housing facilities, rec centers, things of that nature to ensure that we were providing services for Mobile County. And that was my way of, impacting the change in lives of, us as, outside of the clinical services. So in 2015, we were afforded the opportunity to be awarded a grant through CDC Cooperative Grant under Teen Prevention Branch. And so with that opportunity, we looked at reducing the teen prevention rate in Mobile County. We successfully did that. We impacted over 5,000 members of the community, but the biggest result was being able to reduce the teen prevention rate by 40% in Mobile County over a 5-year span, because that's what the grant was built for. It took some coordination, cooperative agreement, community-based organizations working alongside of the school system, working through feeder patterns to ensure that we were able to impact Mobile County and the residents as well. I think prior to that programming, it was just kind of not talked about. And so what ended up, we had several focus meetings with, the youth, their parents, the school system, the leads, community members, partners and everything. And so at that point, out of those focus groups and the information that was presented, it came to play as far as where, the youth wanted their parents to talk to them about it, or some adult, a trusted adult. And so at that point, what changed as far as in allowing the parents to, allow their teens to come a part of, the programming that we had, evidence-based programming, to actually teach them about making a difference, making proud choices. So it was a great feat. A lot of work went into it, a lot of team efforts as far as from, looking at our community partners, faith-based partners, parents, school system, as well as our facilitators throughout the community that impacted the lives of those youth. I would tell our community, knowing that the setup that we have, that, in being able to work with the community, we utilize evidence-based programming. We have strategies in place as far as prevention messaging that we're able to go out. We have facilitators, outreach educators, health educators that's able to impact the community, even now community health workers, to explain different disparities, why this is happening, why that is happening, even the process of immunizations. What is the focal point of this? Why do we need this? What does it, dispel the myths that may be out there? But getting factual information, ensuring that it is evidence-based, I think is key in order to dispel those myth rumors about what we do in public health and why do we have to have vaccines and immunizations. I would encourage community members to go to our website, take the opportunity to look into the history of public health and what the Mobile County Health Department offers, possibly even have an opportunity to look at one of our annual reports, the most recent year, or just it goes back several years, but to see all of the impact that we've had in the community over all of our programs, and just how wide variety of services we provide outside of clinical services to the community.